currently the lab operations manager here at Singing River, and I'm also the chemistry technical supervisor. I help ensure daily operation here, ensure that the staff are able to perform their job best they can. They have everything they need. What we do is we receive specimens here in the laboratory. We check them pre-analytical for all the accuracy that needs to be there to ensure appropriate testing. They're delivered to the different technical departments. They're put on these amazing analyzers we have, high technology. We perform those tests, and then they're also reviewed post-analytically by our technicians before they're released to the physicians. So we receive all of our specimens here at the tube system, the majority of our specimens that are in-house. So cancer centers, CHF clinic, any of the inpatients on the floor, the outpatient draw station, everyone sends their specimens through the tube system if it's not a critical specimen that they have to walk up. So this is constantly being, specimens are constantly dropping. Now, until we open these tubes up and check what we have, we treat all specimens as stat until we can get the tube in hand and learn how to prioritize it. So we don't ever want anything sitting here. This tube station's manned at all times, and we always have someone in here working, processing, checking the specimens in, and delivering them to the departments. So when we load these on our machine, we can load them with the lids on or the lids off. We put them on. This picks it up, and it'll deliver it to the instruments for testing. It'll take them here to another centrifuge we have on board. This is taking the specimens, putting them in a centrifuge here, where it'll be spun down, and we'll be able to obtain that plasma or serum for testing. So in the event that your CBC is ran on our analyzer and it needs to be further looked at by our technologist, if it sees anything abnormal, they will put the specimen on a slide, we will stain it, and then we'll look at it under the microscope. This technologist reviews it for abnormalities to verify it's normal or abnormal, what the shape and the stain looks like. They report this in the report to the ordering provider, and it'll help as a diagnostic tool when they're monitoring patients. Unfortunately, sometimes in the lab, we are the first ones to see those abnormal leukemias and things like that are then taken to the pathologist for review when we find these abnormal cells in the patient's blood. So these are different units of blood. These are red cells, packed red cells. We have these on the shelf in case any of our patients need a red cell transfusion. When you go and donate blood at any blood drive, they will take your unit of whole blood, and they will separate it out, and they will condense those red cells into these packed cells. So these are our platelets, and they're kept on an agitator at room temperature. This is what makes these guys happy. You may need to get a unit of platelets if you're having trouble, your blood's having trouble clotting. Platelets help your blood to clot so that you can stop bleeding. Sometimes these are given during surgery or other times based on different types of disease processes. Here's a different look of a type of platelet. This is a pheresis platelet, so that's all platelets from one actual donor. So when we have to determine if a patient may need a unit of different type of blood product, a specimen will be submitted to the lab for testing. We will determine if that patient has any antibodies present and exactly what type of blood you need, and we'll make sure that blood's free of any antigens that patient may have. That blood's then compatible. It's checked. This is an instrument that can do our blood matching here, and then it can also be done manually. Of course, if needed, if we're in a hurry, sometimes we'll do it manually. We may do it on the machine in batches, depending on the urgency of that blood product. We'll ensure it's compatible. There'll be no problem once that patient receives that unit of blood. The doctor may then recheck the levels on some of the other instrumentation we've seen in the lab, and then monitor that patient's progress. When the blood arrives here in the blood bank, it's checked in by our technologist, scanned in the computer to maintain proper inventory, and all the blood we have here on hand is evaluated on a daily basis. We order based on, we have to keep a proper number of minimum inventory on the shelf so we can ensure through all of our surgeries, potential traumas, and our inpatients, we always have an adequate amount of blood available on the shelf for our patients. So we always need O blood. We need everyone to donate, but especially if you are O positive or O negative, we need you to donate because that's considered a universal donor. O negative is a universal donor. Your blood, your red cells can go to any patient. So we're gonna check the temperature because like we said, it's very important for the temperature to be regulated on all of our blood products. If these products weren't received at the appropriate temperature, they will have to be rejected, quarantined, and documented. We cannot put those in our inventory. So in here, in the micro room here at Singing River, we have the ID Nows, which are the instruments that can do COVID testing. So when the nasal swab is collected, the NP swab, it's sent down to the lab. And within about 10 or 15 minutes, we can give the doctor a result for a positive or negative on your COVID test.
Pretty amazing what happens behind the scenes in the lab. I think a lot of people think of a lab as just a little small room, but it's a whole lot of rooms and a whole lot of equipment. It's pretty phenomenal what you guys do, the technology and the chemistry. Tell us, you like the chemistry part of this?
Yes,
It gets you excited, doesn't it?
I'm a little partial to the chemistry. I'm the chemistry technical supervisor at Singing River and Ocean Springs. I've helped ensure the implementation of our instruments. We have to do daily, weekly, monthly maintenance. We have to ensure the instruments are working properly. We do calibrations and we check QC on a daily basis and sometimes even more frequently than that. We have to ensure our instruments are working properly. They're always turning out accurate results, and that we have to ensure that the patient testing can still be performed at the same time in a timely manner while we keep up the maintenance of our instruments.
We talk about quality being in our DNA. It's literally right here in the lab. You guys are a critical part of ensuring that we do deliver the absolute highest quality of medicine. We appreciate all the high standards you guys have, and the double checks and the cross checks, and we can tell you guys take a lot of pride in what you do, so we appreciate that.
We do. Thank you.